Well, good afternoon or good morning or good evening, depending on when you're watching this show. This is Marion Spears Carr, and it's a very special collaborative healthcare thought leadership LinkedIn live show, my show every Friday. And I'm collaborating with an organization that I'm also involved with called the Workplace Wellness Collective. And what makes it exciting is it's an opportunity for me to work once again with someone I care about and think the world of, Samana Jetty. Hello, Samana. Introduce yourself and introduce what we're going to be talking about.
Oh,
Hello,
it's
everyone.
been a minute. I mean, the last time I was live with Marion Spears Carr, who I absolutely adore, was like in November. So I don't
It's
know
been a
what's
while.
taken us so long to like come on live together. Hello, everybody. My name is Samana Jedi. I'm so happy to be here with Marion, with Shelley Kemmerer. Like, this is going to be a fantastic show dedicated to the healthcare workers. Some of you know that I have two companies. There's Jetty Wellness. I do evidence-based wellness consulting for businesses, and the Workplace Wellness Collective, which Marion Spears Carr is a part of, Shelley is now a part of. And we've brought all of the forces together to bring you a phenomenal show. It's going to be super great. Shelley's going to do a lot of the talking, and we're just going to have some fun today. Shelley, how are you today?
I'm great. How are you? I'm so glad to be here with you guys.
I'm so happy to have you. I think I'd love to introduce you, and I want to hear a little bit about you as well. But Marion, do you want to say, introduce yourself to the people that are in your show? This is your show.
Yeah, no, absolutely. No, I love to sit in the back. And by the way, if you're watching live or the replay, post in the comments and let us know where you're watching from. Let us know you're checking in. A little bit later, we'll give you an opportunity to ask questions in the comments, and we can all see them. So please, let's have that conversation going. For those of you who don't know me, I'm Marion Spears Carr. I've been in executive recruiting and leadership development in the healthcare industry for 30 plus years. Since I was very young, as a joke, always, I had a full head of hair when I started in 1991. So you can see what the industry has done to me. I live in Georgia. I'm a native of North Carolina, and I'm a managing partner for an executive search firm called COMHAR Partners. We work with healthcare organizations, life science companies all around the world doing executive search. But I'm very interested in the concept of leadership development from a perspective of not only internally and how we support each other and take care of each other, but also how we take that and build our teams and support our teams and support who we're trying to lead and who we want to follow us. And wellness, particularly around burnout, et cetera, in the healthcare industry, needs to be a key focus of leadership. So that's why I'm so excited about our conversation. Samana, back to you.
This conversation, when I met Shelley, so I want to introduce everybody. First of all, say hi to us. Tell us where you're from. I'm based in Calgary. Shelley is in Seattle, and then we have Marion as well. So this is like a global show, and I want to know where you are from. So put it in the comments because I can see your comments pop in here. So Shelley, let me tell you a little bit about how I met Shelley. I met Shelley on Instagram. Okay, like that is a legit. She slid into my DMs. It was a phenomenal conversation.
Oh, wow. Slid
I
into
love it.
DMs. Wow. Okay.
Social media.
It was perfect. It was exactly what I needed. And you think that we meet people on social media and there's going to be these connections, and this is an example of a true collaborator. And when I met her, we started talking. I learned about her company. She is doing a lot of work in the space of parental burnout and caregiver burnout and helping professionals deal with that. Now, some of you know some of the pillars of the Workplace Wellness Collective are leadership and mental health, as well as thinking about the culture of the workplace. And a lot of us are, I'm single, but a lot of us have other responsibilities. I have a mom that I take care of, and some of you have children and other responsibilities. So what we really want to talk about today, from Shelley, who's also a physician's assistant and the lead strategist of the Workplace Wellness Collective in the parental and caregiver burnout space, is I want to learn from her some of the challenges of what healthcare workers are facing, what she's seeing in the industry. And of course, we're going to talk about strategies, and we'll take some questions from the audience as well. So Shelley, tell us about your story. Why did you start RunTellMom, which I love the name of your company, by the way. And, just tell our audience a little bit about, who you are and how this all came to be.
Sure. So thank you for that intro. And I love that you said slid into the DMs because, the part of social media that I find so kind of bizarre is that we see all these people in images and then like graphics and everything so like well organized and kind of curated, but we don't necessarily meet the human being behind the platform. And I'm very big on collaborating and creating community. That's one of the things that I notice that parents and caregivers really need. And so anytime I see somebody working within the same kind of realm, I always make sure to introduce myself because I don't like the feeling of social media being competitive. I mean, we see it a lot with, you know, LinkedIn, Instagram, TikTok. It's not about that for me. So I really focus on that. But anyway, you know, with RunTellMom, so I help parents and caregivers and healthcare professionals with living children kind of navigate all the unpredictable and predictable transitions throughout parenthood. So for me, that's focusing really on resources and burnout prevention. I try to get people as early as possible to get all of their resources in place so that when they need them, they have them there. And so for me, that's working beyond the space of clinical care. So I want to be almost like the connector, like the liaison between the two and saying, okay, well, you can't be a catch-all. Your provider can't be a catch-all, but I will help you find those additional resources that you may not have as you're going through, you know, I mean, it could be anything. It could be job changes, maybe a new diagnosis in the family, you know, moving, something significant. And so that's kind of the background on me. I generally, I'll do speaking engagements with healthcare professionals. I'll speak to parents and caregivers. A lot of what I'm hearing right now is so many people are burnt out, but yet we see all these hashtags online about self-care. And I think the hacks are also a part of the problem. We cannot hack true, authentic self-care. We have to have the external and the internal forces kind of combined and come together to be able to navigate burnout.
That's fantastic. And I want to give some shout outs to some people that are dropping in. Frank Hughes is checking in from San Antonio. Good to see you, Frank. Emily is checking in from Cincinnati. Rosa in North Idaho. Eldana from Metro Detroit. Martin's checking in from Norway. We really are an international show.
I love it.
Yeah. Dr. Mark Sitzer's checking in from Dallas. Laverne Hamilton's checking in from Hampton, Georgia. Jenna Lynn from Houston, Texas. Sheree's checking in from Dallas, Fort Worth. That's a great group of people checking in. I want to get back into the topic, but I want to come back to something that both of you guys were just talking about. This idea of what we see online when, you know, healthcare workers, you know, there's so much burnout, so much struggle, but then a lot of what they see are other people online, like Instagram or TikTok or Facebook or even on LinkedIn, wherever it might be. And they see people's lives almost, people don't put, it's rare when people put online the bad days, right?
Mm-hmm.
It's all like rainbows and unicorns. Everything's amazing. You know, like my life's so great. Like everybody's like, Mary, somebody said to me one day, it's like, man, you're on LinkedIn all the time. You've got so much going on. You look like you've got your whole life, like things are going well. And I'm like, dude, I'm a train wreck. Are you kidding? Like,
appreciate the honesty there.
Yeah. My point is talk a little bit about that for a moment, about this idea that we need to be focused from a wellness perspective and a burnout perspective on what's reality, what's really going on with each other. And then we can come back to the subject. But I just think it's so important because we're talking about Instagram. We're talking about you guys connecting, and what we see online is not always what we know is real. What are your thoughts on that, Shelley? I didn't mean to hijack, but I just thought that was a good part we need to talk about.
No, I'm happy to talk about it.
Yeah.
I think a lot of, as you mentioned, what we see is curated. You know, we're only getting a glimpse of somebody. I recently spoke at a summit. I was talking about the real life REAL versus the real life REEL. And I'm not the person who coined that term. I did hear that like a while ago, but it really stuck with me because what we do see is this kind of curated feed. A lot of people, I am seeing more and more people are sharing some of their honest truths, what is going on. You know, if they are experiencing healthcare burnout, parental burnout, there are more people that are starting to share, but it's still not it's still not at that level where I feel like once you make so much noise that somebody absolutely positively has to listen and they have to say, we need to change policies here. We need to work on this here. So it's slowly getting there, but I will say, depending on how you utilize social media, you can feel like that. You can feel like other people have it completely together. Other people have, somebody working for you that's creating all of your content, or maybe you're taking the time to create the content yourself, and it's kind of a labor of love because you want to share the content and you're creating stuff so that it's free, easily accessible. So there are a lot of things that I when I look at my feed, I have to keep that in mind always, especially with parenting, is that self-comparison. That is such a trap, because once you start kind of putting that seed in your head and saying, I am not like this person because this person has, their house looks a certain way. They look like they're really enjoying healthcare, and I'm having, second doubts about the career choice that I made. Once we start kind of, I guess, breaking that apart and really looking at some of the reasoning why people might be posting, whether it's for engagement purposes or promoting, a book or a podcast, something, there's always something attached to it. Like social media is that marketing conduit. And so for me, I think to keep myself kind of in having a deeper understanding of what healthcare professionals specifically for this talk are going through, I have to read reports about it. I have to talk to people. And when I talk to people, I ask them to give me their absolute honest opinion. Most of the time, they will. I would say 95% of the time they do give me their honest opinion. A lot of people are dealing with high stress. They're dealing with mounting, administrative tasks, constant changes in staffing. Workplace environment is changing. Maybe, some temporary staff are getting paid more than the people who have been working there for years. And that becomes a bone of contention for people. Harassment, violence, safety concerns, burnout being one of those things from, kind of the culmination of everything. And when we hit this critical tipping point, and maybe we've been kind of teetering on that. I think we've been teetering on that for a while, but the pandemic put that over the edge. And it's like, now you're concerned about, personal safety, public safety, decision-making under extremely stressful conditions, maybe not having the support that you need and deserve from, an administrative standpoint or like the structural standpoint. And so that's the reality of it. It's there are things that are going on that we're not seeing on social media.
Yeah. And you know what I really love too? There's a comment that from Rosa Park. She says, yes, curated real versus real life. I love that. I think that's a comment that we can all relate to, because we are, as content creators in our individual personalities and what we portray on LinkedIn and TikTok and so on, and Instagram, the three of us are doing different things, but we are also showing up. But the one thing that I say, and maybe we should just tie this back to the topic of the conversation, which is who takes care of you, right? So when I'm not doing social media stuff, who's taking care of Marion? Who's taking care of Shelley? Like, I am curious from you, Shelley, because you are someone that talks a lot about evidence-based research and practices. We've seen now this world where pandemic is that was a past life, and now we're seeing this new way of working, and a lot of healthcare workers have left their spaces. I was one of them that left the space of healthcare, but we're seeing new people come back in. I know there's a lot of people that are going back and like dipping their toes back into the careers again, and people who never left. So the people who never left are experiencing some challenges, and the folks who left and are coming back are experiencing new challenges because they want better resources and services. So what are you seeing, or what can you share with healthcare workers with respect to, what are the new ways of working and some challenges that we're seeing in this domain?
So I will say, since you mentioned the evidence-based portion, looking at the U.S. Surgeon General's report, here's just like a quote on the amount lost due to burnout. And I'll start it with that, and then I'll kind of go into everything. So researchers estimate that with annual burnout-related turnover, it costs roughly $9 billion for nurses, and $2 to $6 to $6.3 billion for physicians. Now, I was previously a medical assistant. And I think that a lot of the times, and I am very proud to say that because I know that like medical assistants, all sorts of support staff, administrative staff, like everybody is doing a lot, right? They're trying to get all the patients seen. You're trying to stay on top of like the administrative tasks. You're trying to get to the in basket and prep rooms and all this stuff. So I know that everybody has something going on. You will never catch me say that people in healthcare are lazy, because I know I've seen it in hospitals, clinics, and otherwise. So there's a reason for these numbers, right? So this does not estimate, and does not include turnover among other types of healthcare workers across the continuum of care. So that is directly from US Surgeon General. So obviously burnout is an issue. And when I see hospitals and clinics not make proper adjustments and listening to their staff, faculty, everybody that works there on what works and what doesn't work, then you're not able to change the flow of things. You're not able to kind of really like touch base and reach that person who is struggling within that clinic. And let's say, for an example, that in that clinic, it's a physician who is experiencing burnout, and maybe it's a workflow issue, and the administrative stuff is rolling into their family time. They're not able to spend time, going to recitals or whatever the case may be. So there's a number of things that can be addressed, but when they are not addressed and the suggestions are being made, you have a problem. Like there is your problem. So I think one of the first things that I like to talk a lot about is you have to listen to the people that are making the suggestions when they are in the trenches here. Yeah. So if you have the people who are working within your clinic or hospital setting, and they are willing to give you these suggestions on what would help versus what doesn't help, listen to it and somehow integrate it into the changes that can be made. And yes, it takes time. It's kind of a slog, right? Because you have to go through multiple steps to get things to change. However, you need to listen to the voices. So I think a lot of what is happening now is, if people don't feel like they're heard, they're going to go elsewhere. Yep. And, I know the job market here, at least in Seattle, I work with, there's tons of tech people around here, lots of layoffs right now. Everybody is extremely stressed, talking to colleagues constantly about how they're feeling about burnout, different physician assistants and other people in different roles. And they say, sometimes I just don't feel like I'm being listened to and my suggestions are being taken seriously. So that's one place. That is like bare bones, first place to start, I think, is listening to the suggestions that are being made with the people who are experiencing them firsthand.
Yeah, I agree with you. And I think one of the things, a lot of my audience and the work that I do is with senior leadership of organizations. And one of the big shifts that we've seen in the executive search piece, literally prior to the pandemic, really last 8 to 9 years, is leadership understanding this concept and understanding that it's building a Zen garden outside the hospital so people can walk around. That's not going to solve the problem. It's a flow process or issue, or it's a staffing issue. Matter of fact, good point Marcia's making, I want to bring up here is it's not just RNs and doctors that there's staffing shortages. It's those frontline workers like home health aides, certified nursing assistants, the lack of those people, right? That's so challenging. One of the areas that really took it on the chin during the pandemic was the housekeeping, right? Those people, they still had to be there. There was the stresses there. Martin's making a really good point. I'd love for you to speak of it. I think employers need to see the value in wellness. And he goes on to talk about, I love this, we are all prisoners of our own mind in some way or another. Mm-hmm. Yeah. And I think we're starting to see that shift. But let me ask you a question, Shelley. If you're talking to leaders,
yes,
what's your message to them around this? Obviously, evidence-based, the money, like we can start talking about how much it's hurting us financially as an organization if we're having turnover, if we're having burnout. We talk about that all the time.
Yes.
But at the core center of this, what's the first thing question you would ask a leader around this space, or how do you get them focused on it? Because they're always focused on so many other things. I guess that's the question.
I'm going to answer with something controversial, and it's money.
Love it.
How do you get people? How do you motivate? How do you motivate most people? It's money. So how would your bottom line be affected if all of your staff are burnt out? It impacts everything, truly. So it's patient care delivery, obviously safety, dangers to personal health, to patient health, traumatic experiences. It's a number of things. So we can't just think about, I think burnout, and Sumana and I talk about this quite often. It's like burnout has been utilized, or like in a lot of ways on social media, it's been kind of watered down. And I think that to really think about like the significance, so we're talking about extreme emotional exhaustion, depersonalization, cynicism, feeling a decreased sense of, achievement, personal achievement within the workplace. So those things can have an impact on, patient care delivery, low morale, increased risk of medical errors, staffing shortages, vacancies that can't be filled. I mean, for a lot of people, if you have that reputation, and you can see on, Indeed, or when people are applying for jobs, you can see certain comments on what this position was like prior. People share this information. People are sharing more with social media now, why people leave certain places. Substance abuse, self-medicating, like all sorts of things. So I hear the stories of many, and I hear them from all sides. So I think one of the considerations is money. So how do you save money? Well, first of all, you have to invest in your employees. And bottom line, how do you invest in your employees? I'm not talking about pizza parties. I'm not talking about gift cards. I'm not talking about coffee cards.
No.
I'm talking about, do you offer peer-to-peer support, organizational support? To have a real understanding of what that is. Like, take a look at the healthcare system that you work in. And if you have peer-to-peer support, that's one option. People that you can kind of talk to, knowing that you can trust. Obviously, building trust is another thing. Addressing system-related issues. So, Marion, as you mentioned before, like having a flow in clinic. I can remember as an MA specifically which clinics had the best flow and why that was that way.
Yeah.
And it really started from the leader of that clinic. So if you're going to see, and at that time, and I hate saying this, we were seeing a patient every 7 to 9 minutes.
Wow.
Our clinic was so busy. We were just seeing patient after patient after patient after patient. And at the end of the day, had no energy for anyone. Now, I will say, do I think that is a great way to conduct medicine? Absolutely not. But we had a lot of patients that needed to be seen.
Yeah.
And that's the flow. That's how that clinic was. So we really had to establish flow of what worked for us. And we always had breaks. So let's also celebrate the fact that, people are not celebrate, but recognize the fact that people need rest breaks. People need to sleep. We talk about, surgeons. I mean, so many people, tons of staff, not just surgeons, but people who are working.
Everybody. Yeah, exactly.
Tons of long hours, overtime, not getting sleep. That's another risk for, medical errors and all sorts of things. So talking about sleep, that's huge. Employee resource groups being another thing. What are the special interest groups that exist at an organization? That also tells you some of the things that are in need. So you kind of need to look at a lot of pictures, but bottom line is what is going to keep a business open, and you have to invest in those employees, and that affects your bottom line.
Yeah. And not only that, I mean, the conversation, first of all, I'm loving all the comments. I've got my phone up here so I can see some comments.
Got it going, yeah.
But let's pull up some comments from Marcello. I see that comment. Thank you so much. I am so glad that you are loving the space and you feel a sense of safety. I mean, these conversations and the mission of the collective and all the work that Marion does in the healthcare executive space and all the work that Shelley is doing in the burnout space for parents and caregivers, we want to create a safe space for you and have these conversations. Yeah. I loved what you said about money, right? And I want to tie this to a bow on this, because
Yep.
it's money that the workplace can save 100%, but it's also individually, right? Like I had posted a TikTok the other day about, it isn't just about burnout. It is about your quality of life that can happen after burnout, right? Everyone's like, oh yeah, let's prevent burnout. And I was burned out, but hey man, now I've got anxiety. I have to deal with all this other stuff to make sure my anxiety is like low. I never had anxiety my whole life, but now after burnout, I have anxiety, and I'm having to spend all this money and resources to make sure that I don't lose my sense of self in this anxiety.
Yes.
That's still a cost, but people can have chronic diseases, and people can develop diabetes, cancer, irritable bowel syndrome, skin conditions, hair loss. There's so many other, like fatigue. Imagine after burnout, now your quality of life has completely changed, and you're constantly working now to just save money or make sure that you're putting money towards your own health and wellness. I think that's an important part of going back to who takes care of you. As healthcare workers, I think we need to look inwards first to determine, like, am I willing to burn out to then ruin my next 20, 30 years? Like, am I going to be there for my grandkids, for my kids, for myself? I think I would love for you to speak on that, because where it is getting very diluted. I kind of got a little bit irritated myself being in this space of like, why are we only talking about burnout? Why don't we talk about the stuff that happens after burnout?
Exactly.
Right? That's important. So like
recovery
and restoration. So Shelley, let's hear from you, and then I want to hear from Marian about his thoughts on all of this.
Yes. So I completely agree with you there. There is life after this, right? And so how do we kind of readdress or address some of the things that were kind of cropping up for us when we dig into it and say, what were the things that were causing my burnout? And are there changes that can be made within my life that can address those things? I mean, first, I always think of in your life, if you look at your day-to-day, and I started this practice and I found that it really helped me, but what is truly urgent versus non-urgent? So if I triage my day, because I'm a trained healthcare professional, that is one of the main things. Is like if you go into a clinic, and this is like one of the questions I remember is, here are your 5 patients that are all ready to see you in the ER. Who do you take first? And they were all really difficult cases, but you have to triage based on what is urgent versus less urgent. And so I think day to day for me, how I organize my day is what is most urgent to non-urgent. So that is a way to kind of go through things. So I have a system in place, always scheduling protected time. So for me, every single day I schedule protected time. I don't care what it is. I make that time, even if I have to break that time into chunks, that time is scheduled. And that is for me, that is untouched time. And that is, this is all like new habit formation. That really takes time to create these new habits. And of course, yes, it's easier said than done when you're working in a very busy clinic. You're like, oh, I just have no time for yourself. I have no time for myself. How am I supposed to do this? This is why I want the leaders to kind of take this in and really kind of allow that to sit with you and say, we really need to listen to the staff that are essentially running our clinics and our hospitals to see where they need more time and more space, and how to get that time and space for a break, to eat your lunch, to get a snack, to drink some water, to go to the bathroom. I've even heard some of the worst things about people who aren't able to use a restroom all day long because they're so busy.
Yeah.
So I think those are, obviously those are a couple things. I know a lot of people talk about mindfulness and meditation. I will say this, yes, that is a tool. That is not a be-all, end-all tool. We cannot say to somebody, you must practice mindfulness because that's going to change your life. No, that is not the, that is one of the tools in the toolkit, but you need the toolkit. Doing things that bring you joy.
Yes.
I hear from a lot of people, they say, I don't even remember what it feels like to have a hobby anymore. I don't know what it feels like to like laugh in the same way that I used to laugh, because I just feel so exhausted by my job and, all these other feelings that kind of crop up. So what is it that brings you joy? And exploring that a bit more. If that's a previous hobby that you loved, if you don't like that hobby anymore and you want to try something else that really kind of relaxes you or makes you feel happy, or whatever it is. For me, it's gardening, pulling weeds. I love pulling weeds. I don't know what I'm just like, boop, boop, boop. Those are a couple things. eating, hydrating, exercise. Yes, we hear this a ton on social media. And of course, you always have to check with your healthcare provider based on, what type of exercises and stuff you should be doing. But for me, I learned certain exercises will kind of ramp up anxiousness. So those things I will not start with in the morning. If I'm going to exercise, I'm going to do something different to kind of set my tone for the day. But always making sure that I bring my snacks. I'm drinking water. I have water here. I have my smoothie there. I'm set up. So you set yourself up. But these are habits that sometimes if you don't have them developed, you have to develop them slowly. So don't put the pressure on yourself to change everything overnight. Those are just a few things that kind of cropped up for me.
Y'all know those are good. And I didn't mean to interrupt you because all those things we're talking about, and we're going to run long. Usually the show's only 30 minutes. We're going to go a few more minutes because this is way too good to not. No. That's my point is this is too good. Great comments in the I love the idea that you talked about around peer-to-peer support, supporting others, helping seeing each other, right? And matter of fact, here's a good point. Marcia says, my sister's a registered nurse who worked throughout the pandemic. She doesn't think she's talked to anyone about her feelings.
And
I think, right.
Thank you to your sister. And obviously thank you for your comment. But yes, nurses are unsung heroes, CNAs, unsung heroes.
All of them.
Unsung heroes.
All of them. And I think, I'm always talking from the leadership perspective. Here's another good point. Scheduling personal time first is an effective strategy and I love the fact that you capitalize if you adhere to your commitment to yourself. 100%. I think that absolutely on point, Paula. But also I think as leaders, we need to set the example and give our people permission to do that. Like to say, you take that time. Matter of fact, Tara, who's a DMP down in Texas, nurse practitioner, she's checking in from Houston. She goes, not having the needed minutes just to reset is so hard because of the scheduling, because of the flow you were talking about in a patient environment. One of the things that I've done, I'm really interested in the dynamics of different clinical providers, physicians and nurses, for example. In 2008, we did a pilot around what was the impact of perceived conflict between the doctor and the nurse in front of a patient. So that where would that be in the the OB/GYN environment or the ER? So we did a pilot with ER doctors and ER nurses. We had them create, using these 28 behavioral traits, the perfect doctor. We had the doctor create the perfect doctor and we had the nurses create the perfect doctor. And then we flipped it and we had the doctors create the perfect nurse and the nurses create the perfect nurse. And then we had a discussion around why they place these behavior traits in different places. Back to the burnout piece. What we found was the doctors and the nurses, even though they had worked collegially and worked together a lot, were really didn't see each other in the same light. Matter of fact, one of the traits was quick to act. The nurses placed quick to act very high in their sort. The doctors placed it very low. And we had this conversation, we're like, that doesn't make sense. Wouldn't you want the nurses to be quick to act? And it was a command and control situation for the doctors and the nurses. Well, how does that tie back to what we're talking about? It's real easy for us as leaders and as people to say, my burnout's different than your burnout, or, I'm a doctor, you're this, or a nurse, or whatever. All of our burnouts are similar, but they are very different. So if we're going to support each other, we have to put ourselves in the shoes of the other people. Their family life may not be like our family life. Their ability to exercise and all those things may not be the same as mine. So as leaders, my point is we have to always think about the point of reference of the people that we're trying to help plus ourselves. So sorry, I went on that again, Samana, I always do this when it's you and I.
I love it. I no, I'm loving this conversation because, again, going back to why we brought Shelley to the front and center of the
Yep.
amazing people who are watching the live, by the way. Thank you
Yep.
so much. And I'm seeing
the
more
comments are great.
comments from Martin. I'm seeing more comments from Ma Gemelin, creating a safe space to voice. And oh, there it is. Creating a safe space to voice and to voice and listen to is something that is on the last list while recovering as an organization. Now, Shelley talked about this, Marian, you touched on this as well. You know, the organization has a role to play, the individuals have a role to play, and systemically as communities we also have a role to play. But when we talk about burnout, you're right, Marian, you know, we do get into these conversations of like, they are a little bit different. You know, we all think our burnout is different, we all have access to different resources. You work out, you know, differently than I do, Shelley. I'm the same way because my anxiety is really high in the mornings after my burnout. My workout in the morning can be very intense. It has to be a little bit light, but in the middle of the afternoon, oh, I'm pushing the weights, I'm killing it. But in the daytime, I can't do it because it would really mess up my anxiety. So knowing and having that self-awareness. But what I really want to talk to you about is we're all kind of sick and tired of like this idea of like, we all know what burnout is. We all know some of the challenges and issues of what's happening in the healthcare space. What are we doing to action some of the challenges now? Because now we're in this post-pandemic world. I want to know from you, from the healthcare organizational perspective, from the leaders, and because you go into all these conferences and you consult with these healthcare companies, you know, when you walk in there, like what is the need that you can provide to these organizations? What do you do to support them, for them to get out of and have healthier? We're not churning out, you know, the canary in the coal mine. We don't want a canary to go in and come back all black. We want healthy people and wellness to be active. So what are you providing as a company? What does RunTellMom provide?
Well, I have to say, I have to listen to people on both sides. I have to listen to people from both sides. And a lot of the time you have to consider, are people in administration telling you, giving you the full picture? And this is not to say that I doubt anybody in administration, but we have to think about the full picture of the individuals that are working within the healthcare system, within the clinics and the hospitals. So for instance, just going through these comments, and I was reading, where is it? Not having the needed time to reset is so hard. Absolutely. So are we talking to our staff and faculty about what we need to do if we need to reset? So in the clinic that I gave the example for before, that is, you know, we're seeing patients every 7 to 9 minutes. We had a system that if somebody needed to tap out for however much time, and usually it was a short period of time, you could tap out at that time, go get whatever you needed to get, take a walk around the clinic and just relax, because we did see a lot of it with a state hospital, very intense, you know, patient care needs. There was a lot that needed to be done. So are you talking to people about having those reset times? What was another one here? This is a vicious cycle of burnout, especially in the public healthcare. You know, frustration is building. No one sees you. So when we are talking to our staff and faculty, are we truly listening and doing something about it within the clinical system? So for instance, if they're saying, you know, this is going on with EHR, every time I put in an order, you know, X happens and it creates more time for me, I become more frustrated, then that piles on into my lunch, then I can't take my lunch. Okay, who can come into the clinic and address this one issue? Because I know with EHR, especially with Epic, you always have somebody that's kind of circulating and saying, let's look at the flow of things. Are you creating more work by having a bunch more buttons? You have to push all this stuff here. We have to kind of look at what creates all the additional time by asking people, what is creating all the extra time? It's actually easy and cost reducing to fix, although most leaders seem to focus on short-term gain. That's another point. So what is the long-term benefit in certain things? How are we actually investing in the long-term benefit of making a clinic thrive? So if we're doing short-term things like offering yoga passes, you know, having people show up to a wellness meeting, this is one thing that I will not do. I don't want people to take time out of their busy days during their lunch to come see me.
Exactly.
That's not going to help.
No, exactly.
And that's controversial. That is not going to help. And the
Totally agree
reason
with you.
being, I ask my colleagues, is this something that you would like? And they say, do you want the honest answer? I say, yeah. And they're like, no, because what it feels like is a short-term solution for a long-term issue. Almost all leaders seem to focus on short-term. To fix this, you need to take a timeout.
Yep.
And in many ways, right? So what does that timeout look like? We have a timeout when we go and do surgeries, right? You say all the things that need to be done prior to that surgery, doing a timeout. Everybody who's in the room, what's the surgical site? What surgery are you doing? X, Y, and Z. You take a timeout. So what if we did that in a clinic and said, what are the necessary things today that we need to work on? What does everybody need in this clinic right now? Small things, right? They're not going to change everything overnight, but are we actually checking in and doing a group huddle? Are we doing a regular group huddle? Are we meeting with people individually? Creating a safe space to voice and to be listened to is something that is last on the list. Yes, I agree with that as well. Are we just sending people to HR? HR works for the company. And yes, there are a lot of great people that work in HR that are willing to help you. Bottom line is HR works for the company. So we also have to think about who are our allies here. And who can we really be honest with? Because what if, let's say you go to HR and you're concerned that, you're feeling burnt out and this is the first time that you've gone to HR and maybe, there's a lapse in communication and they're taking that as, oh, well, this person needs to ask for medical leave or something. And that's maybe not what was asked for. They were asking for additional resources for something. And then you kind of lose that connection there, right? And then you start to not trust HR. And I'm not encouraging people to not trust HR. I'm talking about more focusing on our relationships with people within the business and how we cultivate a trusting relationship with people. Exploring
Yeah.
ERPs.
I'll say one thing about that because we have Felipe Cofino, who's our HR VP of HR for Signal
Yeah.
Financial, and he talks about this all the time. There's good HR, and there's medium HR, and then we have the not so we have the bad apples of the HR,
Yeah.
right?
Yeah.
There are good people that we can reach out to, but
Absolutely.
but I think what's also important, I want to hear Marion's perspective on this as well, is when we're in a state of we want to work in a state of burnout. There's a lot of stress. There's chaos everywhere. I think people, and I'm sure our community watching will relate to this, people don't know who
There's
to
goodness.
go to. They don't
Exactly.
know which person to ask for help. I think that's one of the biggest challenges that I had was like during the pandemic when I'm like, okay, do we have like a burnout wellness committee that I can go to? Because I
It
haven't
was
had
tough, yeah.
an apple. It's been like 3 days since I've eaten food. I haven't slept in like weeks, and I'm fizzling away. Like who do I go to give me
Yeah.
some food? Who is my person? So I want to know, Marion, from the leadership perspective, if you've noticed like leaders being a little bit hesitant to be like, that's not my job. Go to HR, and HR is like, well, that's not my job. So then the employee is like, well, I don't know where to go to. Like, what are your
Yes.
thoughts on that?
Yeah, I agree with that. And first, let me show you also what leadership does. Oftentimes, we are multitasking all the time, and when we're multitasking all the time, to this point, like we may say, "Hey, go over to see HR." We would just delegate it. And to give you the example of being crazy in terms of multitasking, Marcia has corrected me. My southern accent has called her Marcia like 4 times. So
I know.
Marcia,
Yeah.
my apologies. But again, use that great example. And thanks for calling me out on it. I apologize and thank you for correcting me. But the point is that you talk about that's what happens in leadership, right? I say, and I'm a leader. I run a practice within a company and have done that so for a long time, and an entrepreneur as well. We get so caught up in what we're trying to do. When someone comes to us, sometimes we're like, oh, well, so-and-so will take care of that. When we've not established that is the key resource. We've not created that. And matter of fact, we probably, to the point about HR, we've probably not empowered them to be our voice for that, or given them the tools, or given them the training. And I agree with something you said, Shelley. I teach a program called the Authentic Gratitude Communication Framework, where we're teaching leaders a very specific framework for communicating gratitude. And it's evidence-based as well. It's this idea around, we need to create neural pathways to people from a positive experience. When I do that training though, there's some certain things around the training that's really important. One, we have to make sure that people are going to get value from it, but at least if they're going to come to the meeting, do it at a time of day where it's not going to be crazy stressful for them. Or if you are going to have them come do it at lunch, feed them something other than a candy bar, right? Yeah. Like, let's put out a spread and say, you know what? Not only are you going to get to go to this workshop, do something to replace that time for them, and then give them time afterwards to do what they need to do. Give them a break. I think you're right. It's like, we're going to give you a wellness program and you're required to be there.
Oh, I have plenty to say about wellness programs and low retention and why that occurs.
Nobody goes, right? Nobody does it. But anyway, Marcy, I'm asking for your forgiveness on my correcting me. Thank you. Samana, we're going to have to wrap it up because we're running long. But,
well, let's wrap it up.
But check it in the comments. But go ahead. I'm going to turn it back over to you.
No, I just wanted to read Felipe's comment because he is the good apple, the wonderful Felipe Cofino, who does incredible things. Hi, Felipe. I always learn so much from him. But his comment about employers need to go to leaders that have integrity and trust. First stop should be your manager or HR. If they're not trustworthy, then they need to find a leader that is trustworthy. Okay. Trust in any relationship. This group right here, these cohort of people right here, the folks who are watching, we all trust each other. We've created a safe space for you to have this conversation with us, but leaders need to do that. And that's going to take some time. You need to develop that. But if leaders are also feeling a sense of burnout, who is your ally? Who is your community? And Shelley, you made a comment about having that peer-to-peer support. And there's a lot of technology now where you can lean on AI-driven peer-to-peer support, or we can create communities like the one that I do with Felipe, Workplace Wellness Hour. We've created a community for you every other Monday because we want to give you opportunities to have a conversation. And we see that every day or every other week and even in Marion's show, people show up because they're like, I'm going to learn something valuable and I'm going to be part of something, and I feel heard and I feel seen and I trust this group. So I want to leave it at that because I know we've gone over time. I want to respect your time, Shelley, as well. Any last thoughts, any shares that you want to share? RunTellMom.com, folks. That's where you can check in with her. I'm going to have another LinkedIn Live with Shelley on the 31st of May as part of the Workplace Wellness Collective, and introduce her again to the community as our lead strategist for parental and caregiver burnout. We're going to have a little bit of a different conversation, not related to healthcare workers, but to a lot of other professionals as well. So that's happening on the 31st. That's her website. She's also on Instagram as well. She's got a massive following there and fantastic content if you're looking for support on, like, I'm a parent, how do I support myself? But any last thoughts from you? And then we'll hand it over to Marion to kind of close this out.
Yeah, no, first of all, I'm so happy to see these comments. And I love when people are actually showing up here and saying, this is what I'm experiencing. And it's not so cut and dry. I mean, every organization and company is going to have something different going on. But now that having this deeper understanding, it's easy to point out some of the issues right up front that can be dealt with, and some take more time. And so I think a lot of it is we really need to talk to each other here. We need to talk to both sides. We need to have an understanding of what one needs. And if you want to create a company, an organization that people truly want to work for, then you have to listen to the people who are working for the company. I think that is just bottom line. And for parents, for caregivers, for healthcare professionals who are not parents or caregivers, I mean, obviously you are a caregiver, right? You're providing care. But obviously, if you have any other questions, you could just email me. Happy to come to your organization and kind of pick through some things so you don't have to, but and happy to do this conversation again since it ran over.
Yeah. Oh no, this is fantastic. And we do need to schedule another one. For those of you who want to learn more about the Workplace Wellness Collective, there's the website right there. Also connect. And by the way, if you're not connected with everybody in the chat or everybody on the panel, hit that LinkedIn connect request. You'll see it says follow. Go to and connect with me. I want to connect with you people. If you want to learn a little bit more about my work in the world of executive recruiting, please go to COMHAR Partners. I'm a partner in that organization, and this is the type of work that we do. We do leadership searches that matter, and this is outstanding to be a part of that. Let us know where you're watching from. Please, this is going to be recorded, so just share this with your network. And last comment, Samana, let's not wait 5 months. We got to get, I know you're busy and I know I'm busy. We need to get our other healthcare thought leadership show back on. So anyway, Shelley, thank you. So there's we'll put you on the spot right in front of everybody.
Listen, I'm in. Marion and I used to do a healthcare thought leadership experience. It was an experience indeed. The two of us were on live on LinkedIn. It was a great time. We need to wrap that up. We're gonna do it. We're gonna bring it back. We're gonna have a conversation. Shelley's coming back for another LinkedIn Live with me. Pop in there, ask your questions. And Shelley, go through the comments later on. If you see people that you want to respond to, we will go back and reply to all the comments. We've read them, but we're going to go back and reply to all the comments in the next couple of days. And we will connect with you. If you have any questions, DM Shelley Kemmerer. We are so excited to have this wonderful, and thank you to COMHAR Partners for this wonderful collaboration, and to, of course, to RunTellMom as well. So I'm just so delighted that everybody came.
Yes,
absolutely.
Thank you all, obviously, for commenting. I think it's just amazing. I'm taking all these things in that I'm seeing. I'm making little notes here, but yeah, thank you all.
Thank you.
Absolutely. We're going to close it on out now. This was a collaboration between the Workplace Wellness Collective, COMHAR Partners, Shelley, and RunTellMom, and we're just glad to be here. Click like, please share with your network. Hope you have a great weekend and a blessed next week, and we'll see you soon.
Thank you, everyone.